Hello there, this is Richele Insurance Girl, guys. Richele Green here just for the health of it. You know, this is May now, and it is Mental Health Awareness Month. So it occurred to me, I've been receiving a lot of calls over the last few months, really, as your advocate, as that person that's just here to advise you on healthcare spending, where to get that coverage that you need. I take this very seriously. As someone that's seen people struggle with mental health, I'm a survivor, a child of suicide, so that's something that I want to make sure no one suffers in silence without the resources that they need. So I'm here for you just for the health of it. Today is honoring Mental Health Awareness Month, and I want to give you some takeaway, some real good digestible information. If you know anyone that's needing coverage for mental health and inpatient mental health, there are not a ton of options out there for them, unfortunately. So, a good place to be in this case is, Medicare over 65. But if you're under 65, it can get a little bit tricky to get that coverage. So, two places to find coverage for inpatient mental health and for psychiatric therapies. So, not a lot of private insurance is going to cover this. I personally sell private insurance, but I am not the one that's going to be trying to sell you anything if someone is having a mental health crisis or an ongoing issue. So there are two places to get that coverage, and one is going to be on the Affordable Care Act on the marketplace. Fortunately, the marketplace is open for enrollment. It looks like it's going to be open all through summer at this point, where normally there would just be a 6-week window where you could get into those health plans. Some recent legislation from our president has opened that marketplace. Those are income-based plans, but no question will you have coverage for mental health. Now, they're mostly HMOs, so there is some limited networks, and there's still going to be, some barriers for certain folks, but there is some coverage there. The second place where it's mandated by most employer group plans, and that would be through an employer health plan. So those typically do have some level of coverage for mental health. And I just think it's important to share this out with folks. I know it's not the sexiest topic when it comes to healthcare spending, but it is certainly something that's an epidemic in this country. And since the pandemic, there's certainly been an uptick in the need for access to mental health care. So many folks have lost their employer coverage and don't have that access. So do me a favor, comment on whatever takeaway you had from this, and please share this. I think it's just of service to everyone. Again, I don't sell coverage for mental health, but as your advocate, I do it all just for the health of it, and I want to make sure that people are protected, especially from bankruptcy, especially those suffering in silence. So this is Richele Insurance Girl, just for the health of it.